And we're now live. You can proceed.
Thank you so much for joining us today. Before we get started, we'd like to begin with a brief message from Gilbert Martinez from our communications team for our Spanish-speaking viewers. Gilbert?
Buenas noches y bienvenidos a la sesión informativa organizada por la supervisora Hopkins y la doctora Mace. Esta sesión informativa se está transmitiendo en vivo por nuestro canal de YouTube con la interpretación al español. Para escuchar la versión en español, puede usar el link de YouTube que se encuentra en la página de Facebook del Condado de Sonoma. Gracias. Ahora regresamos para atrás con supervisora Lynda Hopkins.
Thank you so much, Gilbert. I really appreciate it. I'm Lynda Hopkins, supervisor for Sonoma County's 5th District and chair of the Board of Supervisors. Welcome to our COVID-19 and vaccine community briefing for Wednesday, February 24th. Our vaccination efforts continue to ramp up. This week, we expanded our eligibility threshold to include those 65 and older, as well as essential workers in the grocery and restaurant industries. This brings Sonoma County fully into Phase 1B, Tier 1 of the vaccine distribution strategy that we began just over 2 months ago. While we are pleased that we have reached a point that we're able to open up our clinics to more residents, this is a large population group, and we are still dealing with a very limited supply of vaccines. Appointments are hard to come by, so please be patient until our supply increases. Overall, the county is working closely in partnership with our healthcare providers, and we have now administered doses to more than 95,000 Sonoma County residents working together, which represents more than 23% of our population aged 16 and older. We've also passed an important and meaningful milestone for our county. We have now fully vaccinated more residents with 2 doses, 28,401, than we have had total COVID cases, 27,803, since the pandemic began a year ago. I want to take this opportunity just to acknowledge all of the fantastic hard work of everyone who has worked on this effort, especially our vaccine mission team and our health services department. Sonoma County continues to be ahead of the state curve in terms of vaccines administered, and we would not have been able to accomplish this without all of your hard work. I also want to thank our partners for helping us reach out into all of the corners of our community with a focus on equitably distributing this vaccine. It has truly been a collaborative and cooperative effort. We're working to ensure that these efforts in pushing for an equitable distribution of vaccines in our county will continue on when a third-party administrator, Blue Shield, takes over the vaccine distribution within the next couple of weeks. We'll be discussing that more during today's briefing. Finally, I just want to say thank you to all of you, our residents of Sonoma County, for your continued patience. Information sometimes changes on a daily basis these days, and we really appreciate your flexibility as we build this plane while we're flying it. On March 7th, Sonoma County will join the second wave of counties under Blue Shield's operation as a third-party administrator for all COVID vaccines in the state of California. What will this mean for our vaccination campaign and all of our established partnerships? That's exactly what we're going to be discussing tonight. So to start us off, I'd like to turn to my colleague, Supervisor James Gore, who represents the 4th District, to talk more about what he has learned this week about the third-party administrator and efforts to help reopen Sonoma County a little more. James, take it away.
Thank you, Chair Hopkins, and thank you everybody who's here with us. Pleasure to be with you tonight. I'm going to be here for the presentation portion. If anything that I say requires follow-up that I'm not able to provide because I'm going to be on the call for about a half hour, encourage anybody to follow up with me, but obviously Paul Gullickson and Lynda and our staff can do that directly. So in addition to being, we've done this a couple times, but in addition to being a Sonoma County supervisor, I'm also president of the California State Association of Counties. We had a call today with the governor and with his senior staff, including Secretary Galley and others, and went over priority implementation areas around the third-party administrator, as well as other issues that I'll go over briefly. So the first thing is that a lot of people have questions about what happens on March 7th when Blue Shield and with the support of Kaiser take over this vaccine administration. If you take a chance to look at the actual contract with the state, the one thing that I feel confident that this is going to deal with is, of all random things, it's the data transfer. There was a big issue that many of you know about between the state's database system, the CARES system, and counties uploading information on how many vaccines were being administered without having full picture of how many vaccines were being sent to primary providers in the same county. So, for example, if the state sent vaccines directly to Sutter, Kaiser, St. Joe's, we got to see those and how they were. That's in the bailiwick and in the representation of those primary providers to put those into people's arms and to report back, maybe through the county. We all update it together. But the other side is that the county gets an allocation of vaccines for the federally qualified health clinics, and also for our vital vaccinations through our partners to frontline workers, also law enforcement and other areas like that. So what this meant was that there was a lot of stuff that was not fitting into the gaps, and the just-in-time data going back to the state and therefore justifying to the federal area for more vaccines wasn't as quick as it needed to be and wasn't accurate. So a lot of people have different opinions about this third-party administrator. From my perspective, and from a lot of us with California State Association of Counties, is at least it will take care of the data exchange system. And we as counties can focus on some core priorities. So with Blue Shield coming in, we're working collaboratively with them to make sure that they get the data they need and get the vaccines out to the partners that we don't manage. But then at the same time, we're going to be advocating for the county system, along with our federally qualified health clinic partners, to be able to directly address the equity goals. Latino population, where we've had surges in our cases since the beginning of COVID, vulnerable seniors, also other vulnerable populations throughout. Many of you know that the federally qualified health clinics, referred to by the acronym FQHCs, are the primary provider in Sonoma County for Medi-Cal recipients, which is Medicaid here in California, and then also the uninsured, what we term old term of art is the indigent care. So the goal for us is to really go after that. And there's been an issue that we've identified with some of our federally qualified health centers, which is the reimbursement rate versus how much it costs. We can't have our clinics going under while they're doing this vital work. And also a reminder that even though equity is always listed as a priority, it does take more time, more effort, and important work to get out to the most vulnerable in our community. Equity is a hard thing to achieve, but it is the absolute mandate of what's before us. So what are we doing? Well, we're evaluating kind of a gap analysis at the county we agreed upon on our Tuesday meeting to review with the federally qualified health clinics their needs and to try and get some consensus across them. What are their needs? If it's funding for outreach, if it's other backfill for reimbursements. And then we're also looking at who funds that, whether that's a contribution of local partners or whether that's with county funding that might come through the state, or whether it's direct state funding, or even through a program which is of the federal government giving vaccines directly to these health clinics. So that equity portion is going to be a priority for us in the coming weeks, and it is already. For those of you who don't know some of these names, right, up in my district or in Lynda's district, West Community Health, if you look out in North County, Alliance Medical Center and Alexander Valley Health Clinic. Give you a quick example. We got a notice from Alliance about their work in the Hillsburg, Geyserville, Windsor area. And as of about the 20th of February, they had almost 3,000 vaccines out, 63% of those to Latino population. And so you can see that that's the place that we need to go to be able to go after this equity issue full force. So we need to support them because that's where individuals already go for their care. Second thing I wanted to provide an update on outside of the third-party administrator in Blue Shield is that we are in consultations with the governor and do anticipate that the tier system, which is currently, as you all know, red, purple, orange, and yellow, is going to be amended. And what we have been advocating for is to have that amended to reflect vaccinations, for vaccinations to be also utilized in a reopening strategy. This is extremely important. Why? Because testing has completely changed. Dr. Mace and others can attest to this. They've represented it to our board, and they'll probably go over it today. But before it was much easier to get testing in certain degrees because we had what I would call frequent flyers, people who are working, healthcare workers, people who are working in high contact jobs. and other vulnerable individuals who were getting tested a lot to make sure they were safe. Those same individuals are getting vaccinated first, and so aren't going back to the same testing regime as before. Now, how does that affect us? Well, if we drop low in terms of the number of tests that are out there or that we're administering, then it affects the multiplier that the state utilizes to evaluate our actual versus our adjusted numbers. And so that can hold us back from reopening safely, is what I would say. So we do anticipate we're working over the coming days with the governor's office on exactly what that vaccine criteria is going to look like, but we do anticipate movement on that in this coming week, and are trying to make sure that it's attuned to unique communities instead of just an aggregate that is this many doses in California and this many people. A couple other things is that the governor talked with us about is the incoming authorization of Johnson & Johnson vaccines, with 20 million of those currently ready to go, and 10% of those coming to California. The governor also talked about how this past week we had 1.4 million vaccines come to the state. This next week it's going to be 1.52. It is going to be scaling up, and there will be a huge amount of vaccines that are anticipated to arrive in May, June, July. At that time, we do anticipate that it will go from a supply chain incongruency where we have more demand than supply, as we do now, more eligible people than vaccines we get in, over to a point where we have more vaccines than individuals to go after. And that's where we have to deal with the hesitancy of vaccinations. And the request to all of our community partners out there is to help us work with individuals to get direct information into their hands, because that's when the conversation will happen about, are there mandates that are going in for schools and other areas out of the state or the Fed? How do we get to this place where we achieve herd immunity? And can we achieve herd immunity with voluntary vaccinations, or is that something that comes in with public health rules? We anticipate that to be at the state and at the federal level, but that's something for people to track. Third thing is with respect to schools, is many of you know that there's a little bit of a kerfuffle going on at the state with some legislation moving through from the legislature, counteracting with the governor's initial plans for reopening schools K through 6. We do anticipate that there will be a deal reached that puts more resources on the ground to public schools, and that should come in this coming week, if not the following. But at the same time, who knows? Those are all part of non-certain discussions. And one of the things that we advocated for strongly and feel that we have the support from the administration is also for those schools that are already open, have a waiver, have site plans, and are executing safely their work, is for them to be able to move beyond the K to 6 grade category and age range and move potentially into middle school and to high school. So if there are schools that are already open, that have proven their ability to manage their site plans effectively, they'd be able to move into other students. We also anticipate movement on that in the next week or two. So those are the things that we are tracking with the state predominantly. And I just want to thank everybody out there and ask for folks to continue to exercise diligence, because even though the vaccines are coming in, there's still guidelines for masking and social distancing and new iterations of what we call variants, mutations. The West Coast variant was something the governor talked about today, that he said he has been talking about for 3 to 4 weeks, but is just now, some people are realizing it. But a reminder that these variants still fit into a system of vaccinations that Dr. Shende and Dr. Mace can lead you into. So I want to pass it off to those two amazing leaders in our community, our doctors, and thank you for the time, Chair Hopkins. Yippee-ki-yay.
Great, thank you so much, Supervisor Gore. That was an excellent update. And thank you, Chairwoman Hopkins, and everybody else who is now participating. I want to speak some about our case rate and metrics. We do continue to see a leveling of our case rate and testing positivity, the two key metrics that the state is using to determine when we can advance to a less restrictive tiers in the blueprint. Now, what I'm going to do is share my screen And can you see this okay?
Yes.
Yeah,
I think
looks
that's
good.
a yes. Good. All right. So I just want to take you to our own website, socoemergency.org, in case you haven't been there. There's a wealth of information on this website that anybody can access from a tablet, an iPhone, any computer. So basically, if you look here, you can see that our case rate, new case rate per day per 100,000 is 14. And at the height of our surge, we were at a case rate close to 50. So this has improved significantly. However, it is not at the less than 7 that is required for us to get into the red tier. So we're still in purple. You can see where red is. And if we can have this case rate on that criterion alone, then we can go into the red tier, as long as these are in the red tier, which they already are. So I will talk some about how testing can help us get this case rate down. Now, our overall testing positivity has always been really good. So that means that a lot of you are going to OptumServe or LHI to get your test status. And because we're testing a lot of people, you know, we have a fairly low test positivity overall. And we've been in the orange for quite a while for this metric. The lower SES, or the Healthy Places Index metric, this one, we also want to try to get into the orange. And right now we're in the red, and we're fluctuating. As I said in a previous briefing, we were at 5.2%. Now we're at 7.7%. Now, and I think actually today we may be at 7%. So this bumps around a bit and indicates that we still have a lot of cases. And we still do have quite a ways to go in terms of getting out of the red category. However, this is going in the right direction. And I'm going to tell you how testing is going to help us in this process. Now, let me go to our testing part of this equation. And this will sort of help you understand why it is we're seeing what we're seeing. As you can see, you know, we had been doing testing and then we really ramped up. If you can recall, October 19th, we put into place our new testing strategy and just went out and went after a lot of people and got the message out that you should get tested, whether you're symptomatic or asymptomatic. And because of the holidays and people's concern, I believe, about potentially getting together with family or traveling or things like that, testing went up and up and up, and a lot of people went to get tested. And we found a lot of cases. And now you can see after January 1st that we have had a significant decrease in our testing. So what this does is it increases our positivity because only sick people are going in to getting tested. So you can imagine if the numerator or the top number in the ratio is full of people who are positive and the denominator or the lower number is lower, then our positivity percentage, the rate, is higher. So what we want to do, and it totally aligns with what we want to do, is the right thing to do. We want to find those of you who potentially are asymptomatic who still have COVID. And we know we still have widespread transmission in our community because we're in the purple tier. So even though you may not be symptomatic, or you may not have had an exposure that you know about, it's okay to get tested. And that's what the state is encouraging us to do. Because not only will that increase the denominator of people getting tested, therefore lowering our percentage positive, it also allows us to get, let me stop sharing here so we can get back to discussing this. So it also allows us to get a good correction factor for our case rate. So somewhere in the end of the year, in December, we were able to multiply our case rate by 0.5, halve our case rate. And as I just showed you, our case rate's 14. It's been like 13.8. If we could again get that multiplier of 0.5, we'd be in the red tier automatically. So the reason the state gives us this sort of multiplication factor is to encourage testing, because we know 30 to 40% of people out there with COVID could be asymptomatic, have no idea they have COVID, and still pass it to others, and increase the amount of transmission we're seeing in a community. So it all makes sense, in other words. But we're doing the right thing by getting you all out there to get tested, whether asymptomatic or symptomatic. And at the same time, simultaneously, we're getting rewarded by the state so we can move into a lower tier. So let me tell you, though, that we do have some good news. I think, well, a lot of good news, really, because our case rate and testing positivity has dramatically decreased in the last month. But also, because our case rate has been below 25 new cases per day per 100,000 for several weeks, elementary schools can start to reopen. Schools do need to submit reopening safety plans to the state and the county for review before they can reopen. Schools that had approved waivers back in November and December under the previous reopening plan are allowed to reopen now, provided that they update their safety plans. We have 10 schools that have approved waivers and 6 schools that now we have, in addition, that we've approved in the last couple of weeks due to their stellar reopening plan. The schools that have with approved waivers from before are the Presentation School, the Healdsburg School, Sonoma Country Day School, St. John the Baptist, Summerfield Waldorf School, Harvest Christian School, Redwood Adventist Academy, St. Eugene's Cathedral School, St. Francis Solano Catholic School, and Bodega Bay Elementary School. The schools that now have approved safety plans and can move to reopen are the Spring Hill School, Victory Christian Academy, Sebastopol Independent Charter, Liberty School District, St. Rose School, and Sonoma Charter School. At Public Health, we're busy reviewing an additional 24 reopening plans, and very soon we'll be announcing more schools to be open. Once we can move into the red tier, then grades 7 through 12 can begin to reopen. So again, I think everybody should do their part and get out and be tested. We have the OptumServe sites in Windsor, Santa Rosa, and Petaluma, your own physician, and numerous pop-ups that you can find on our website. So thanks very much. Let's continue the facial coverings, social distancing, and our general hygiene measures, and get tested. Now I'll turn it over to Dr. Shende for an update on our vaccination campaign.
Thank you very much, Dr. Mace. That was very, very helpful, very informative. As Supervisor Hopkins mentioned, we are now vaccinating our Phase 1B Tier 1 population, including seniors 65 and older, as well as essential workers in education, public safety, and food and agriculture. Under state guidelines, we're still prioritizing our oldest residents first. We're setting aside 70% of our vaccine doses for seniors and the remaining 30% for essential workers. We know that these essential workers make up a large group, and there's not enough supply to vaccinate everyone at the same time. So we're asking for everyone's patience, and we will eventually get to everyone. It's just going to take time. We've now administered 123,609 vaccine doses, including 66,807 residents with first doses and 28,401 residents fully vaccinated with 2 doses. The residents with at least 1 dose include 66% of our 75 and older population, 52% of our 70 to 74-year-old population, roughly 35% of our over 65 population, and 17% of our Latinx population. Again, the county's role in coordinating vaccine distribution will significantly change on March 7, when Blue Shield takes over as the third-party administrator. So we want to focus the rest of this evening's briefing addressing questions about this process. For more on this, I'd like to turn to Ken Tassif, our Vaccine Mission Manager.
Thank you, Dr. Shende. So as Chair Hopkins and Supervisor Gore mentioned, third-party administrator is going to be coming on board on March 7th, and most of our current county providers will be contracting with Blue Shield. The good news is that Blue Shield has informed us that they'd like to keep our current structure of vaccine clinics in place, and they want to continue to use the providers that we are using. In addition, the Blue Shield contract with the state emphasizes rapid delivery of vaccine with incentives to ensure that the vaccines are distributed within the state's equity framework. Now, what will Blue Shield be doing specifically? Well, they're going to be doing vaccine distribution and allocation. They will make the decisions about how much each county gets of the state's allocation. And then within the county, they will also determine where the vaccine goes by provider. In addition, the vaccine producers, Moderna, Pfizer, and eventually Johnson & Johnson, will distribute the vaccines directly to the providers based on Blue Shield's allocation. Still a little unclear with Blue Shield, as Chair Hopkins said, they're building the plane and flying it at the same time, how they'll handle local issues like how to get vaccine to the current providers that we are delivering to. The county will not be a direct provider, and the county will not be receiving vaccine any longer once Blue Shield takes over. So that's one of the things that that Blue Shield will be doing, and one of the major things. They'll also be in charge of vaccine integrity. In other words, ensuring that the vaccine doesn't spoil and is used properly. The second thing they'll be doing is providing contractors with, providing contracts with the contractors that are out there. And we're going to be recommending the providers that we are using to Blue Shield, and they have expressed that they will be able to take those. Most of those are our hospital systems, our current federally qualified healthcare systems, and certain provider groups that are helping with things like homebound seniors and so on that can do travel vaccines. The other thing that will be happening is that all of the providers in California that are on the third-party system will be using the My Turn appointment system. Now, the My Turn appointment system is an end-to-end system that includes scheduling, intake, and then upload to the state's database as the department, or as Supervisor Gore had mentioned. And that's an important part of our success in the state. The state will also have a call-in center for those who do not have computer access or who need registration help. Lastly, the state will provide, or Accenture, who's the third-party contractor to help with My Turn, will provide technical support to the providers who are using My Turn. So what's the county going to do to support this? We will lose some control over the vaccine, but one of the things that's happened is that Blue Shield, we've had discussions with Blue Shield, and they've said they are interested in our advice on how the vaccine is allocated within our county. They know that we're the experts on where it should go, and we're also the experts on ensuring that equity plan is in place. So we'll be advising on that, along with distribution and integrity of the vaccine. We also are recommending the providers, as I said, to be contracted. We'll be coordinating provider communication and collaboration. And all along, we've had lots of meetings, regular meetings with all of the providers to ensure that we have consistent communication, collaboration, and consistency in vaccine administration and the client experience, which is important. We're collaborating with stakeholders to get input, and Leap Solutions has taken the lead on that with us. We've contracted with them, and they'll continue to lead our efforts to provide outreach within stakeholder groups and get feedback on how best to reach the community. We'll provide vaccine center support to ensure provider success, and that's really important. We've got approximately 180 staff at no cost to the federally qualified health centers, supporting their efforts to get vaccines to people. And we've provided them space, we've provided them infrastructure, we've provided them technical support and signing, PPE, just to help ensure site consistency and make sure that they're successful and that they can focus on what they do best, which is clinical support or clinical administration of the vaccine. We're going to be supporting the equity framework by ensuring that we have bilingual staff in place, forms, signing, and staff cultural competency training to ensure that, again, clients have a great experience at the clinics. And then lastly, we're going to provide additional technical support on my turn and for the providers. We expect long wait times on state technical support line. We've had that experience as they have rolled out several new software programs, and we want to be an additional resource where our providers can get many of their problems solved quickly in order to allow them, again, to focus on vaccine administration and reduce client frustration. So while we may lose some control over allocation and control of the vaccine, we will be able to continue to influence the third-party administrator and provide a great deal of support to those that are going to be serving the community. So now I'll turn it back to Supervisor Hopkins.
Thank you so much, Ken and Dr. Shende and Dr. Mace for the great updates. We're running a little bit short on time, and I want to make sure that we have plenty of opportunities for questions from members of the public and also the media. So I think I'm going to shake up the agenda a little bit. And I do know that we're also joined this evening by Dr. Mitnick. And I'm wondering, Dr. Mitnick, if you might like to, just share a little bit of an update with the members of the public prior to us going to questions from the media and members of the public.
Sure. So right now, vaccine supply for us remains our primary constraint in vaccine deployment. In addition to not receiving our expected and needed supply allocation from the state, we were impacted.
I hate to interrupt, but I'm having a little hard time with your audio, and I don't think it's just me. I think some other folks are struggling as well.
Let me try to get closer.
There we go.
Better?
That sounds so much better. Thank you so much.
All right. So we've really had a lot of issues with our supply of vaccine, and the weather last week in the Midwest delayed a significant amount of our supply of the Moderna. So right now we have our mass vaccination clinic on our two care site clinics. They are still vaccinating for second doses, and that continues. We did have to put on hold last week the scheduling of all new vaccine appointments, awaiting the ability to fulfill those appointments with vaccine. Our scheduling still continues to be when open on our website as well as by telephone. We're also informing our patients right now that in the future, as we begin revaccinating first dose, we actually can't guarantee second dose at this point until we're assured that the supply chain is much more stable and more robust. And all of our clinics on appointments are all based on making an appointment. So we hope that as the vaccine supply gets better and more consistent, we will be able to quickly restart our efforts and really get back to full capacity, because we can really vaccinate a lot of patients every day, but we need vaccine to do it. Thank you.
Thank you so much for that update. And I was actually browsing some of the state data and looking at some of the media coverage regarding vaccine supply, and actually noted that Sonoma County received 5% fewer vaccines sort of for this week than we had from the prior week, which makes it very difficult because we're struggling to stay on top of those second doses of vaccine. So thank you very much for sharing that update. Now I will hand it over to Paul Gullickson to go ahead and field questions.
Thank you, Chair Hopkins. Thank you, everybody. This is really good information, and we have a number of questions from the public. A few of them really concentrate on one basic question, and I'll send this to Dr. Mace. It can be summarized in just a simple question: why are we still in purple? I guess that's the really question that's on a lot of people's mind. We've been in purple so long, since ever since the blueprint was really created. What are your thoughts?
Yeah, thanks so much for that question, everybody who's asking that. And we in public health have asked that of ourselves many, many times. And, our county is really quite different from some of the counties that we're bordering or close to, certainly in the Bay Area. I mean, as you may or may not have heard, our epidemiologists really looked at sort of demographics and the race, ethnicity of our population, how many agricultural farm workers and food producing members we have in our county, as well as residents over a certain age that are in congregate settings. And we found that we are closer in terms of those characteristics to counties like Monterey, Tulare, Ventura, ones that have actually stayed in the purple this entire time as well. And we have particular challenges in terms of the vulnerability of our population, the difficulty in outreaching to certain groups and sectors, and things like, so for example, with the food and agricultural worker group, the fact that they live in very close quarters and don't have the ability to not get COVID. And they've been the essential workforce, and they also don't have easy ways to isolate and quarantine. So there are some specific things about our county that differentiate us from some of the other counties around us that have moved into red and maybe even into orange. But I can tell you that now I feel that the fact that we've really dropped the numbers of testing is holding us back. And that's why I today really laid out what I think we need to be doing as a county, as a community, to move towards the red. It's really great and heartening to hear Supervisor Gore say that the the blueprint is being reevaluated now that we have vaccines on board, to see if there's some way we can also take into account vaccination for reopening. Because as you've heard from our wonderful vaccine staff here, Sonoma County is actually in the forefront in terms of vaccinating. So I'm hoping that that will also factor in to the reopening. Meanwhile, if we can get more people tested and get those numbers back to where they were, say in the end of November and December, I think we have a really good shot at moving towards the red tier. But so we have our own work to be done. And remember, it all aligns with what we need to do, which is finding the cases quickly, getting them isolated, and getting contacts evaluated and quarantined. So if everybody gets tested, we will reach the overall goals that are important as well.
Well, on that note, we also have a few questions from people wanting to know more precisely on who should be getting tested. Does that include people who've gotten vaccinated? Who are we really asking to go and get tested?
Well, I think even after vaccination, people can get COVID. And we found, the clinical trials didn't really look specifically, at least all of them didn't look specifically at the issue of once vaccinated, if you're asymptomatic, no symptoms, could you have still gotten COVID? But we know that a certain percentage of people do get COVID even after vaccination. I would say if you've been vaccinated and you're feeling ill, you should go ahead and get tested. Now, the rest of the community, of which we know we still have like 80% of people that need vaccination, I believe that if you feel you have any risk at all, or even if you feel like you've been in an indoor market, or if you've been anywhere where you feel like you could have any risk, you should go ahead and get tested. It will be helpful for you to know your status and for the community and your family to know your status as well. I don't know, Dr. Shandy, do you want to add anything about that in terms of people who are vaccinated and what their risk is?
Yeah, I just wanted to mention that I agree with everything that Dr. Mays said. But in addition, many people feel that they should only get tested if they've had symptoms of any kind. And that's not the case. So as Dr. Mays said, if there's been any concern of exposure, certainly get tested. If there's, whether you have symptoms or not, consider getting tested. The more that we're able to test the general population and identify and isolate these cases, then the sooner we're going to get to being able to recover from all this. And one other thing to keep in mind is at this point, we have vaccinated somewhere in the range of about 8% of the population with 2 doses, I believe. And it's going to take a while before we get to herd immunity, which is considered to be somewhere in the range of 70 to 80% of people who either are fully vaccinated with 2 doses plus 2 weeks, or people who have had the infection. And of course, we don't want to get to a point of 80% of our entire population being infected with COVID, but it's going to be a combination of getting that vaccination supply out and also identifying people who actually have had COVID. And once we get to 70 to 80%, which will probably be later on this year, probably in the fall or so, that's the point at which we will be able to start really changing a lot of our practices. But until that point, it's extremely important to take all these preventative measures: testing, hand washing, wearing masks, staying apart from people. And all that being said, keep in mind that over the next 6 months or so, there's going to be a lot of light at the end of the tunnel, and things are going to start changing for all of us.
Thank you very much. Dr. Shendy, while you're here, we have a couple of questions related to those who have been a part of that large phase 1B tier 1 group that we've allowed in to opened up to have vaccines. Specifically, they note that that both grocery workers and restaurant workers are now eligible, but when you go on our website, it notes that that they're both being encouraged to contact their employers. Do you have any other guidance on how restaurant workers and ag workers can get back?
Yeah, this is a tough situation, because even though we are now at that stage, phase 1B tier 1, and we have opened it up to everyone, our problem continues to be vaccine supply. As Chair Hopkins mentioned, we did finally get our allocations, and we are only receiving 7,680 vaccines this week. That's nowhere near enough to be able to vaccinate everybody who's eligible in this tier. So at this point, yes, speaking to the employers, we are trying to set up some vaccination events through some of our allocating partners, but again, it's very limited. Reaching out to your primary care providers is another route, but keep in mind that over the next 2 to 3 weeks, as the vaccine supply increases and as we go to the third-party administrator, when we expect we're going to get a lot more supply, that's when a lot more opportunities will open up. So I would say, be patient, and over the next 3 to 4 weeks, we should start to see more opportunities come up. But for right now, employers as well as primary care providers and patients.
Great, thank you. Sloan asks that we've noted that there were a number of schools for their COVID safety plans and have the opportunity to open up soon. Sloan asks, what about high schools? What is needed? Do we need to be in the red tier or the orange tier in order to let them reopen? Dr. Mason?
Yeah, we do need to be in the red tier. And actually, I'm going to turn this over to our Deputy County Counsel, Adam Radke, who's sort of an expert now in this terms of the orders and school reopening.
Yes, for grades 7th through 12th grade, regardless of whether the school may be like TK through 8th grade, but grades 7th through 12th grade can return to in-person instruction once the county is in the red tier. The state just revised its FAQs to say that as soon as the county is in the red tier and the school has posted their COVID safety plan, CSP, online, then they can return to in-person instruction for grades 7 through 12.
They all need to post their COVID safety plans, correct?
Correct.
Yeah. Okay. Great. Well, all the more reason that we can hope to get into the red tier soon. Let's
Right, and if I can just
go to
quickly
our
add, Paul, just one quick thing. Once that happens and schools do open, even if we were to jump back into the purple tier, and Adam, feel free to add, the schools remain open at that point. Correct, Adam?
Schools have a 3-week window from eligibility to either reopen or return at least one grade to in-person learning as part of a what the state has been calling a phased-in approach for reopening. And if they have done that within the 3-week period, even if the county were to return to the purple tier, they would be allowed to continue to remain open or continue their phased-in reopening strategy, such as if they were to bring in one grade like TK through 3rd or 7th through 8th, and with the anticipation that they will bring in other grades later down the line as part of a phased-in strategy.
Great. Thank you. Thank you both. Let's go to our media partners. We'll start with Martin Espinoza from the Press Democrat. Martin?
Hello. I have a question about the third-party administrator. And King Kassoff had said that we don't expect, or that the county will no longer be distributing vaccine. Who will be distributing vaccine? I thought I read in the state's contract with Blue Shield that they would not be responsible for providing vaccine. Do we know who's going to be, where the vaccine is going to be coming from?
Yeah, Martin, I can certainly answer that. So even currently, vaccines that are going to our community clinics don't run through our public health lab. They actually, while it is part of our allocation, they are on a ship direct program. So the supplier or a distributor, for example, with Moderna, McKesson Incorporated distributes it and sends it directly to those locations, and they receive it, versus other providers such as OptumServe. Currently, we're delivering straight from our public health lab on a daily basis. But for most of the providers, they are getting direct ship.
A question about Dr. Shende had said that we are expecting more vaccine once this third-party plan kicks in a couple of weeks. Is that, can you qualify that, Dr. Shende, or do we know for sure that we're going to get more vaccine, or is that just because in a couple of weeks everybody's going to be getting more vaccine as production ramps up?
That's correct, Martin. So what we have heard is that in the beginning of March, they are expecting to be able to supply a lot more vaccine because everybody is going to be getting that much more. Right now, it seems, as I think we may have discussed in the last press briefing, that they may be allocating more towards those who have gone into the first wave of the TPA. And they will probably do the same when it is our turn around March 7th. And that also coincides with the beginning of March, when it's expected that there's going to be more vaccine supply in general, and that the TPA will start to distribute more proportionally.
And this anybody can answer this question, but is there any concern that this is just going to add another layer of bureaucracy or confusion to the whole process? It sounds, yesterday, Supervisor Gore had sort of stated that, you know, we've now come into our own in terms of our distribution plan. We've got more, you know, we're kind of honing the whole process down, and now this. Is there any confusion that this could kind of just at least be another hiccup? Is there any concern? I'm sorry.
Martin, I'll go ahead and answer that. And the answer is absolutely there's concern. And as I had articulated, we're going to lose control over the vaccine distribution and allocation process. That being said, I think I pretty clearly articulated that we have a lot of pieces in place, plan Bs in place, to ensure that if there's breakdowns in their systems, that we've got backups, because we're doing it now. That's the good news. We're doing it now. So we are not dismantling anything until we are confident that the third-party administrator has it right. And as a matter of fact, I just had a conversation with my IT manager about ensuring that our providers have everything available to them in case they can't get through to Accenture, for example, and get tech support, that we can be that backup for them to the extent that we're able. We may not be systems administrators, but we will be subject matter experts on the system.
If I could just
I would
add
just
to
add-
that.
Go ahead.
Sorry, if I could just add to that, that I think we've experienced during this whole vaccine rollout process, it's not easy. It's not easy for anybody. There are a lot of things to be learned. There are a lot of challenges. There are a lot of bumps in the road. So we are going to do everything we can to try and make that transition as smooth as possible, particularly because we've learned a lot in this process, and we know a lot of the nuances, a lot of the ins and outs on how to try to address equity, how to get the vaccine, how to maintain the vaccine integrity, all these issues. So we are really going to work hard with the third-party administrator, with Blue Cross, to make sure that all the things that we have put into place lead to as successful of a rollout as possible. But I think we all have to just be cognizant of the fact that this is not easy. I'd like to also add that we have really been working on our infrastructure, as you all have heard. And as I mentioned, our allocations for this week are 7,680. If we had enough vaccine supply, we would be able to do at least 6 times that much, if not more. So we have built up our capacity at this point within the last basically 5 to 6 weeks through a lot of hard work, a lot of collaboration, a lot of reach out to the community. So we're really positioned well to be able to pour out the vaccine if we could only get that supply. So we're going to do everything we can to try and make this smooth, but we just want everyone to understand that there are going to be some hiccups, and we'll just work through them.
Right,
And
I just want to say that the
if I
answer
can
to
just add one quick thing, and that is that, the state is dealing with 58 different counties of different sizes, different demographics, and one size doesn't fit all. So I feel like, I know here in Sonoma County, we've been doing really, really well with vaccinations. And I think the third-party administrator coming in, we're going to try to keep that flow going from our end in public health and make sure that we're involved to the extent that we continue the strides that we've achieved so far.
And, I just want to say quickly, add my 2 cents that I think the answer to your question, Martin, is absolutely. And I am extremely proud of the tireless, exhaustive efforts of Sonoma County staff to build a system that's really centered around equity. And it's a complex system, and it has a lot of different players. And we've, sort of called it a constellation approach. We're going to be shifting from this constellation approach where we work with trusted community partners who have deep relationships with the communities that they serve, to a much more centralized command and control approach that is really designed at, getting that vaccine out the door as quickly as possible. And so it's going to be a shift. And we're going to be continuing to advocate to keep the elements of our system that have so supported our most vulnerable members of our community. And that's going to be really our role going forward. And like Ken said, we are trying hard, even though we won't have the authority, to not abdicate the responsibility, right? And to make sure that we're still there to respond to people's concerns and questions as we move forward. But it's going to be challenging. And we've seen that every single transition that has involved the state, whether it was honestly that OptumServe system, other things, they've presented challenges, but we're going to be there to try to help keep it going and to, be as positive and forward facing as we can.
Thank you, all of you.
Okay, on that note, we're near the top of the hour, but we'll go to one more question, and it really has to do with the very things you're talking about. And in this case, it has to do with the transition to the myturn.ca.gov site. We're going to go from 20 different ways to make an appointment in Sonoma County to one way to make an appointment throughout the entire state, and some of the concerns about how that's going to work. Ken, maybe you could answer if somebody has made an appointment already, and their second dose is going to come after March 7th when we make this transition. Do they need to do something, or is that second appointment still going to be in the system when they go to the MyTurn site?
Accenture and Blue Shield have both said that they will be continuing to support, for example, the PrepMod system that's in place, or the My Turn, whichever the appointment's been made on. There are some systems that may remain in place though. For example, those pharmacies that'll still be on the federal pharmacy program may not be on My Turn. So not every appointment will be on My Turn, but most of them, and certainly all that go through the third-party administrator system. But yes, they have assured us that that if you've got your first appointment, you will get your second appointment, and the appointment will be kept.
Okay, well, it's one of the reasons why we are encouraging people now to go ahead and go to the myturn.ca.gov site to register, and because we will be transitioning over to that. But for the time being, the list of clinics that are available are on socoemergency.org/vaccine, where you can find out all the different clinics that are offering vaccines at this point. At this time, I'll go back to Chair Hopkins.
And I believe that takes us to the end of our time together. I just want to say thank you so much to all of our panelists for participating, to the members of the public for asking those questions and participating. And I look forward to seeing you all same time next week, same place, and we will see you next week. Take care and be well.